Laurence, I'll just give a very brief welcome to everyone before we get started, if that's okay.
Brilliant, thank you.
Yeah. So good morning, everyone. I'm delighted to be able to welcome you to this meeting of the All-Party Group on Learning Disability on UN International Day of Persons with Disabilities. It's obviously a really important opportunity for us to, sorry, if I could just ask everyone when you're not speaking, to go on mute, please, if that's okay. That'll assist with feedback. Thanks very much. So a really important opportunity for us to present the findings and recommendations of the Ulster University study on the impact of COVID on people with a learning disability in partnership with MenCap, Positive Futures, CAN, the Compass Advocacy Network, and Finney Families Involved in Northern Ireland. Delighted to say that, as you can see, we will hear from Professor Laurence Taggart from the Centre for Intellectual and Developmental Disabilities at Ulster University on the impact of COVID-19 on people with learning disabilities, and Professor Roy McConkey from the Centre for Intellectual and Developmental Disabilities at Ulster University on the recommendations based on the COVID-19 study and learnings from our local context. Before I pass to Professor Taggart, can I just emphasize the 7 key asks that are going to flow from these findings in our meeting today? One is that our 5 health and social care trusts urgently communicate their recovery plans for learning disability services, notably day centre and short break provision. 2, that the reform of social care proposals make specific mention of learning disability provision, not least as this accounts for around 6% of health and social care spend. That's for social services within the Department of Health to action. 3, that the proposed new model for learning disability services be validated with service users, family carers, and service providers, and a revised learning disability service framework must be implemented, including costs for the Health and Social Care Board to action. 4, linked with the foregoing, the Minister should commission a value for money review of learning disability service provision in Northern Ireland. This would include inequalities in provision across the 5 trusts, and the review should be completed within 5 months. 5, implementation of personal budgets and the use of self-directed support to empower people with learning disabilities to have more choice and control over their lives, and that should be published from ministerial sign-off further to the Equalise review in 2017. 6, we ask that the deaths of people with a learning disability, those who develop COVID-19 and future infections in their family home, own home and residential care are recorded and recognised. And 7, that the Department of Health appoint a learning disability reviewer who has clear responsibility for holding the system to account for delivering agreed outcomes and policy implementation for people with learning disabilities. Delighted to then hand over to Professor Laurence Taggart, who will take us through this extremely important study on the impact of COVID-19 on people with learning disabilities. Thanks, Laurence.
Thanks very much, Chris. Well, hopefully you can all see the PowerPoint. First of all, thank you to the All-Party Committee on Learning Disability for inviting myself and Roy along. This report is based upon a UK study that we have been undertaking across the 4 nations. And it has also been in conjunction with, as you were saying, CAN, Finney, MenCap, and Positive Futures. So they've had a big input into how we designed the study and how we identified participants, and then the results and the policy implications. So what I'm going to do this morning is I'm just going to give a very short background to the study, inform you how we conducted the study, give you a short summary of the results. And as you can imagine, these results are quite lengthy, and there are appendices where you can get fuller details. Then Roy will give a summary of our implications for policy and practice, again based upon the 7 asks. And then we hope to have a discussion that Chris will chair among all the people here today. So first of all, I want to set the scene, say, why are we here? What's the purpose of today? And I think the words of this particular family carer is very poignant, and hopefully you'll hear some of the key messages that is happening. So this is just a short audio of a family carer.
I am a mother and carer to two boys aged 27 and 16. Some words I would use to describe COVID are scary, exhausting, emotional, challenging, lonely, and devastating. COVID really started for us when some stats were released indicating that many COVID-19 deaths arose from underlying health conditions or for those with disabilities. Although perhaps intended as a reassurance to the majority, they left myself and my family feeling very frightened. This, combined with examples of a blanket application of DNRs on disabled people's medical notes and early draft NICE guidance, implying lesser treatment priority for people with disabilities or for those who were more fragile, left me both horrified and terrified. The fear that gripped and overwhelmed me was sickening. The realization that the very services and people that we were proud of and should be protecting my family were now not. I felt they had abandoned us. I felt failed. Because of this, the desperation to protect our sons became overwhelming. The mental and physical exhaustion that came from not only caring 24/7, but also the insane protective measures we put in place took a few weeks to surface, but it came. I became the only person to leave our home when really necessary, days of making do with what we had to avoid going out, then the sterilisation process I undertook when I did. This extreme behaviour, coupled with the guilt that I may actually bring COVID into our home and risk the above, became in itself mentally destructive. You can never really relay the fear, sleepless nights, obsessive clinging behaviours, anxiety, tears, worry, weight loss, not eating, and loneliness, endured because of a need not only to protect our sons from COVID, but to protect them from any hospital admission, as I knew what I had read, and that staff were not equipped to care for our sons in the best of times, so I feared they stood no chance during the pandemic. This fear still remains. For me, COVID has made very clear the inequity within our healthcare system alone, and this must change. Social care over COVID has been equally challenging, and I feel the support never came, even remotely. Contact is initiated for the most part by myself, seeking ideas, making proposals or suggestions on how things could make our lives a little easier and less stressful, only to be dismissed with no alternatives offered. I felt like I was begging. I felt inadequate. Soon the asking stopped as the exhaustion took over. I feel the lack of clear guidance on creative use of SD's budgets while personal assistants were no longer entering our homes was a missed opportunity to channel help and support. Indeed, this still remains the case. I felt let down. The odd email for an exercise class, carers chat, or an art Zoom class for our sons was a long way off from the support we needed. I felt angry. The return of day opportunities or information regarding community programs never came and is still slow to come. The frustration just continues to build. Help and support from the start of this nightmare to where we are now remains pretty much the same, non-existent. Your sons have a budget, get on with it. Just a bit more paperwork thrown in for the fun. Advocating ideas and suggestions for what will help meet our sons' needs are just shut down. Flexibility and choice are still restrained. COVID has taught me much and highlighted more. I've realised as a carer I am also disabled, albeit differently from my sons. I've established a greater insight into how our lives are impacted, not because of the disability, but because of societal barriers. I don't want payment, thanks, or sympathy. I want a choice in whether I should be a carer or a mother. I want my sons to have the right to a full and meaningful life. People need to understand disability and understand that the person with a disability does not need to be fixed, but that it is society, attitudes, frameworks, and legislation that need to be addressed. It's clear for me that the trust is gone and needs to be built. And for me, this depends on everyone being confident that all lives are of equal value and for people to realise that impairment can come to any of us at any time and that all lives matter. If any lessons are learned from COVID, it should be that it has to be easier than this, and that people with lived experience are the people who really know and need to be at the forefront of all decision making. And when this happens, then for me there is hope.
I think you would agree with me that the exhaustion in the parent's voice, it's very profound, her words, and very striking, and I hope you hear them carefully. And I think what we have done throughout this study, not only within Northern Ireland, but throughout the rest of the UK, is echo what this Muller has said in our findings. So let me give you some background very quickly. There's approximately 1.5 million people with learning disabilities across the UK, and currently there are about 18,000 people in Northern Ireland known to learning disability services. And there may be more people with a mild learning disability who at this stage don't access learning disability services. There's been a number of studies in the last 18 months that have shown higher COVID-19 infection rates and deaths among this population in many countries. Questions have been raised about how people with learning disabilities are being supported through the pandemic. And there's been a number of international and national research studies, but many exclude people with learning disabilities. And for those studies that do include people with learning disabilities, they don't ask people with learning disabilities and they don't ask family carers directly. And this is what we wanted to do. We wanted to capture the voice of the person with learning disabilities and the family carers and highlight the urgent policy related issues that this group needs addressed. So again, I don't know if you've seen this chart, but in the red is the deaths of the population, the general population from the end of November to January this year. And as you can see, it's always smaller than the blue. And the blue bar chart is people with learning disability. We know that people with learning disability are more likely to die from COVID, more likely to have developed COVID at a younger age and potentially have more severe symptoms. And that's why we need this study. So why did we have this study? We worked with Professor Chris Hatton from Manchester Metropolitan University and Professor Richard Hastings from Warwick University. And there was a consortium of 22 UK universities across the UK. And each country had 4 voluntary partner organisations. We wanted to track people with learning disabilities and their family carers' experiences, circumstances and supports throughout the pandemic. The aim of the project was to identify the well-being, the health and social effects of the COVID-19 pandemic, including the social restrictions and changes to how adults with learning disabilities were supported across the UK, and to determine those changes that have occurred over 9 months. And we wanted to gather this information to benefit policymakers, groups of people with learning disabilities, family members, and organisations across the UK. This is the website for the whole UK study at the bottom of this PowerPoint if you want further information. So how did we conduct the study? In total, we interviewed 621 persons with a mild to moderate learning disability using either telephone or Zoom. And in Northern Ireland, we interviewed 127 specifically. The interviews started in December last year, and then they were repeated in April and August, so there was 3 time points. We also interviewed 378 family carers or paid carers of persons with more severe or profound learning disability, and they were completed using an online questionnaire, again, at the same 3 time points. And in Northern Ireland, we were able to recruit 62 family carers. So in total, we have information on 999 persons with learning disabilities. And that's the biggest study in the world at this stage on COVID-19 and the impact of COVID-19 and restrictions on this population. So trying to go and give you a glimpse of the results. So what about COVID-19 infections and compliance regulations? As I was saying, research shows that people with learning disabilities contracted COVID at a younger age, developed more severe symptoms, and were at a greater risk of hospitalisation with a higher mortality rate. In our study, we found 6% of people with learning disabilities had tested positive for COVID-19, and another 4% thought they had COVID, but were not tested. Over half of persons with learning disabilities had an underlying health condition, such as asthma and epilepsy. And of those testing positive or thought to have COVID, 1 in 7 were hospitalised. And in our sample of 999 people, 13% had someone close to them that had died because of COVID. So people with learning disabilities experience COVID-19 at least to the same extent as the general population, but with more severely affected and a higher mortality rate. More adults with learning disabilities are being tested for COVID-19. We found that 8 out of 9 persons with mild learning disabilities wore a face mask when they were out, and 3/4 of people with learning disabilities reported that mask wearing and social distancing should be maintained even when restrictions were lifted. By August 2021, which is a great result, 96% of our population had been vaccinated, with another 86% willing to take a booster jab. 1/3 of persons with mild learning disabilities had shielded at some point in 2020, which rose to half of those who had more severe disabilities. And this was far higher than the general population. And I remember speaking to one mother, and she said to me it was a forced self-isolation that she had to do, given the risk that her son may develop COVID who had Down syndrome. We also asked those with a mild, moderate learning disability, how many of you had a mobile phone and had downloaded the app? Now, 25% of our sample had downloaded the app, but how they were using it or when they were using it, we didn't find that out. So what we found was, from this sample, people with learning disabilities have been responsible citizens in complying with public health advice, but there are some difficulties with technology. So what about the impact of the restrictions of COVID-19 on persons with learning disabilities and family carers? You're going to hear now the voice of Derek, and Derek's a member of CAM, and Janet's interviewing him.
My name is Derek Campbell. I live in
Fairways.
yes, Fairways.
Fairways.
Yes.
And you live in a house with how many other people, Derek?
2 boys a minute. That's all.
2 guys at the minute.
Yes.
And do you have staff coming in and out, Derek?
Yes, we do. Yes.
Okay, you have staff supporting you.
Yes.
So tell us about how you felt whenever you heard about this thing, COVID, coming.
I'm still looking at it.
Yeah, I know you're tired looking at it now, but how did you feel? Do you remember way back whenever we first heard about COVID?
Not annoyed about it.
Bit annoyed. And what annoyed you?
I can't see my daddy.
You can't see your daddy. Okay, so that was the most difficult thing, was not seeing your family. What about the things that you used to do during the day as well? Were you able to do all of them?
No.
No, and you're quite a sociable being. You
Yes.
like to be out and about.
Yeah, I feel up something who's had to Jeffrey back there.
Yeah, you like to be out and about, and you go to the pub.
Yes, I do. Yes, I go for a drink.
You go for a drink. So you like going to watch the football.
Yes.
And you go out to your work as
Yes,
well.
I do. Yeah, I do.
So you like to go out to your work, and you go
Yes.
to the base
Yes, I do.
as well. So all of that stopped. How did
Yes.
that feel?
The board.
Really bored. And were you able to take part in any of the Zoom calls or
Yes, I did. Yes.
phone calls and keep in touch
Yes.
with people that way?
I did.
Do you think that helped?
Yes, I bet.
I
I
bet.
bet. Bored.
It was still a bit boring in between, wasn't it? It's not the same as getting out and about.
No,
And what did you miss the most, do you think?
my work.
Your work. And what about the football? Because all the
Yes.
football stopped as well,
The
didn't
best
it?
buddies too. That's the best
And
buddies.
best buddies. Although we were able to do some meetups. and
Yes.
we were able to do
Yes.
some Zoom meetings
Yes.
and get together and have
Yes. Yes.
kind of disco nights and things like that. Did
Yes.
you take part in all of them?
Yes, I did. Yes.
You did, good man. So what about the vaccine? Whenever we heard that there was a vaccine coming, how did you
Yes.
feel about that?
That's good. That's good.
You felt that was a good thing?
Yes.
Okay, and were you worried about getting the vaccine
No.
at all?
Nope.
No,
Nope.
you don't
fine.
mind needles or
Nope.
anything like that?
Nope.
No, so you went quite happily to get your vaccine?
I'm fine with a blood test now. I took it last week. It's grand.
It's grand.
It's
Okay.
not so active. The nurse talked to me I'm going to do a blood test here. It's starting in front of me. I said, not that I only stuck a needle in and asking often.
Yeah, no. So you're happy enough to get the next vaccine. If you have to have another one, you're happy enough.
Yes, I will go for it. Yes, I will go.
Good man. And tell me about Christmas last year. Was Christmas a wee bit different for you?
Yes, it's crap.
Right. And what was crap about it?
We can't do it for meals. So carry on.
It was kind of difficult, wasn't it, getting out for Christmas dinners?
Yes,
Because of where you live and work and be involved in best buddies and base, you would normally have a lot of Christmas parties, wouldn't you?
yes, I do, yes.
Yeah, so you would, in the run up to Christmas, you'd be pretty busy.
Yes, yes.
Yeah, and it wasn't like that last year.
No, it's not like that last year. It's boring.
You didn't get to the panto last year either.
No.
Okay, well, how do you feel now, Derek, about COVID? Do you think we've come through it? Do you think it's...
Won't say it's going to get worse. Hope not. They're talking about it. It's going to get worse.
I hope not, definitely.
Hope not too.
It's kind of worrying at the moment. Yeah, there's a lot of people
see, I get
locally.
all the world. See, that's worrying me. Hope that's not COVID.
Yeah.
And I got a test from London. I'm cleared.
Yeah, no, you're clear of COVID at the minute.
Yes.
Okay, and how do you feel about going forward? Do you think we're going to have to learn to live with COVID?
I will have to live with it. I can't stop learning about it.
And we were shopping yesterday, weren't we?
Yes.
And what was the thing that annoyed you yesterday about COVID?
Masks. You can't breathe them.
Yeah, so you struggle with the masks, don't you?
Push them up, they keep sliding down your nose all the time.
Yeah.
No, they're annoying.
Okay, well, thank you very much, Derek.
Yes.
Thank you.
Yes, ma'am.
You can hear the voices of Derek, and again, we found very similar when we spoke to all the adults with learning disabilities, both within Northern Ireland and across the UK. So some of the striking findings that we found was about the impact of the restrictions of the COVID-19 on people with learning disabilities, as the first family member for family care reported, was this loss of daycare, loss of respite, loss of employment for those people with learning disabilities who had a job, a loss of education and community activities, that the burden that this placed upon many family carers, and this stopped overnight. And for those people with learning disabilities living in residential accommodation, it was loss of contact with family. And again, you'll hear this shortly, still to this day, there are still homes that are restricting visits and having people outside the window. Half of people with learning disabilities were reported about leaving the house due to COVID-19. 19% of the adults with mild learning disabilities and 20%.
That's what it looks like. I mean, it's not exactly something to take pictures from.
Sorry, if you could just mute yourself, please, that would be very helpful. Someone maybe just come in. 19% of adults with mild learning disabilities and 28% of adults with severe learning disabilities reported new or worsening health conditions in the last 4 weeks. And there was a reduction in health services and annual health checks, the things that keep people with learning disabilities well. So we found that the physical health and emotional well-being of people with a learning disability has not improved as restrictions are lifted, and this has more serious implications for this population. Over half of family carers of adults with a severe profound learning disability reported getting less support than they used to into their homes prior to COVID. Over half of family carers reported feelings of stress, tiredness, disturbed sleep. 14% of family carers have contacted their GP in the last 4 weeks regarding their own health. And most family carers have not been consulted about the changes to their health. And a third of family carers, people with severe profound learning disability.
Laurence, if I could just pause you, I think this is a really important
Did you see the line in the Belfast Telegraph yesterday that Phil's saying that some of the schools have been told they'll be back after Christmas part-time?
Is that Julia?
Yeah.
As host, I think you can mute.
Oh, well, because it did name one of the schools. Does it list name the school?
If whoever is host, I think if you go into the participants list, you can ensure.
It's unfortunate it was set up with the secretary working. I can't mute somebody.
It looks like it might allow me to claim host.
Okay, great.
Don't want to disrupt your presentation though, Laurence.
It may be quicker to email Julia. That's sometimes the easiest way to get hold of somebody if they're not aware, and just tell them.
Okay. Thanks for that suggestion. If someone has any contact details, if they'd be content to contact Julia, just to give her a notification that she might want to mute her device.
Okay, I'll try and see if I can.
It is quite loud. Apologies.
You're all right.
I've contacted Julia, Chris.
Thanks very much. It does look like it would allow me to claim host, but I'm really reluctant to disrupt your presentation, Laurence.
No, that's okay. Okay.
There we go.
So,
I think that's us. Thanks, Laurence.
okay, thank you. So just to say that the physical health and emotional well-being of family carers has not improved as restrictions have lifted, and there continues limited access to health services. So I'm just going to show you a graph. So like you're saying to you, we undertook the study in December, and then we repeated again in April, and then in August. So you can see the 3 waves. So if you look at the column on the left, what you can see is nearly 60% of family carers feeling stressed, reporting that they're stressed. And this has not changed over the 3 time points during COVID. Likewise, over 60% of family carers, in fact, this has increased. Over 60% of family carers, again, are reporting that they're feeling tired, and this is not decreased over the 3 time points. Similarly, disturbed sleep, feeling depressed, short-tempered, physical strain, and making a existing health condition worse, and contact. But you can see all the conditions that the family carers reported, they are not decreasing over the 3 time points. And this is worrying given how the concerns that we have going through with Omicron and future or whatever is going to happen in the next few months. So I'm just going to let you listen to the voice of another family carer and a young man with autism and learning disability called Dean.
When COVID struck, I was absolutely shocked by Dean's reaction. I always knew that Dean didn't think like you and I think. You know, we see the world in thousands of shades of grey, and Dean is just black and white. And one of my friends is a special needs teacher, and she said to me, coping with autism is like standing on a wobble board and having balls thrown at you. And it was probably the best description I've ever heard of how it is with autism. And Dean was totally overwhelmed with the news, you know, around March time, year before last. And he became addicted to the news more than ever. He wouldn't normally be. And he asked so many questions. Because he works directly with the public in a petrol station, on the till and outside, he was really anxious about catching COVID. And for the first time ever, I saw a real wobble in his mental health to a worrying degree. He since told me that he did think about driving his car into a brick wall, which was horrific. And I wasn't aware of that at the time, but I had no support. The only person I was able to speak to was my GP. Dean had to stop working for about 12 weeks. And it was like living with a different person. He lost his sparkle. He was introvert. He was anxious. He wasn't eating properly. He wasn't able to sleep. First time ever I've had to get him something to help him sleep. He was doing things like taking hot baths, which he would normally just jump in the shower, but he was having to try to relax. And he became super dependent on me and his dad, and was just, I could see, overwhelmed by this international, you know, situation. I'm worried that he could get it, I could get it, all of our family could get it, and just asked lots of questions, and was really, it's hard to describe, just completely overwhelmed by it and could think about nothing else.
When lockdown happened, it was really bad, and I wasn't at a very good place at work, so I had to get out of work, and just sort of calm down, like, and because everything was just going so quickly, like, you know, and it just rapidly got going and everything, like, so I just took the escape route, you know, and just stayed at home, like, you know, like my doctors would advise me anyway, you know, to stay at home because due to my my autism and everything, like, you know, it was just one of those things, like, you know, and I think they just didn't want to take the risk, you know, and take my anxiety, you know, to a really high extreme level at that time. It was just quite a bit of a big shock, like, you know, because we're not quite used to, you know, being isolated, you know, from the world. Like, you know, it was a bit like, you know, you went into like the Big Brother house or something and didn't know what was going on in the outside world, like, you know, and you were stuck indoors and you could only maybe just walk here and there, you know, so it felt like that, you know.
Do you think the whole thing has affected your mental health at all?
Yes, it has, definitely, because you just sometimes, you know, you need something like, you know, like whenever the nightclubs hit, you know, and they shut right down and everything, you know, that really was, you know, and hospitality shut down and everything. That was when, you know, my mental health kind of went down, like, you know, because I wasn't used to not going out or anything, like, and, you know, seeing my mates every other weekend or one weekend, like, you know, being like a long period of three months at a time, like, was quite a bit sort of really tough as well, like, you know, so you just need that sort of that just sort of, you know, socialization, but like, you know, to you know, really, you know, like sort of I don't know the word, like, you know, just keep your mind occupied, basically, you know, because if you don't keep your mind occupied, you really are going to go, your mental health just go right down.
And have you felt a lot more isolated?
Now or
as a result of lockdown?
As a result of lockdown, at that time, yes, I did feel very locked down, like, you know, it was just very, very hard, like, you know, and it just felt like you were just under a lock and key, like you couldn't get out of the cage or anything. So
how do you think things could have been handled better, and what do you think he needs now?
Well, the GP is the core person usually in all health issues. It was very hard to speak to the GP. I had to get a sick line for him for his work. And other than issuing him a sick line and doing maybe one phone call, there was nothing. I think it would have really helped to have had someone nominated to maybe have a weekly call with him, someone to come out and see him, even if it was in the garden or at a distance safely, to reassure him, a third party to support me, my husband. And just the thing is, you know, people know what to do, but it's always the issue of getting the funding and putting the services in place. I don't doubt that in this day and age, everyone knows what should be done, but it always comes back to the funding. And mental health, the only thing I would say is, since COVID, mental health has become a very hot topic, and I think people recognise it. So many people that I know who didn't have mental health problems now are suffering, and they're not afraid to say they're suffering. So that has been a positive, but still, Dean's mental health is not as good as it was, and still there is no support for him.
So that's the words from Dean and his mother, and I think it echoed Derek's voice and the audio recording of the parent earlier on. So just looking at some of the impact of COVID-19's restrictions on social relationships. So during 2020, 70% of people with learning disabilities living in supported accommodation or residential care were not allowed by service providers to have visitors into their home. This was also the case for 20% of people living with families in their own accommodation. By August 2021, around 5% of persons with a mild learning disability still had restrictions placed upon them. and these restrictions rose to 25% with those with a more severe profound learning disability. 2/3 of persons with a severe profound learning disability were reported by their family and paid carers to have reacted negatively to visitor restrictions, isolation, boredom, frustration, and confusion about why things have changed. They had great difficulty understanding why their mum and dad were not visiting or why they couldn't get out to their day centres. Over 60% of people with a mild learning disability no longer took part in any community activities. And this was in 2020, and this figure rose to 85% for those with more severe profound learning disability. And by August 2021, around 50% of people with all learning disabilities were still not using community activities. For the small number of people with learning disabilities who had paid work prior to COVID, just over 50% were still at work at the end of 2020. Likewise, only 30% of those who had been doing voluntary work were still active. And by August 2021, fewer than 30% remained in paid work, and only 10% were still undertaking voluntary work. So to conclude, the social lives of people with learning disabilities were severely restricted during COVID-19 and have yet to fully recover. So support has not returned to the pre-pandemic levels. For people with learning disabilities who had received day services prior to COVID, 57% no longer received any statutory day services, and a further 35% had reduced services. For those who had received short respite breaks, 60% had none in 2020, and 45% had a reduction in their breaks in April 2021. And by August 2021, fewer than 1 in 5 had received a short break in the last 4 weeks. Half of adults with mild learning disabilities had no longer had visits from social worker, and this rose nearly to 3/4 for those with more severe learning disabilities in 2020. And by August 2021, 1/4 reported having contact with social workers, mainly by telephone. The support from statutory services available to people with learning disabilities disappeared or remarkably reduced during 2020, and they have not resumed to the pre-COVID levels. The impact that COVID-19 is continuing to have on this population. 5% of our sample reported that their life had come back to the way it was before COVID-19 started. That means for 95%, their lives have been disrupted and continues to be disrupted. Over 80% of adults with mild learning disabilities and family carers think that support workers should have to have the COVID-19 vaccination. And most people mostly reported that reinstating public health measures such as face masks and social distancing and having low local COVID-19 case rates would help them feel safe to go out. People with learning disabilities and family carers want to return to their normal life, but staff need vaccinated and to wear face masks. Despite the gloom that's been presented, there has been some positive outcomes from COVID-19 and a lot of creativity. There's been new forms of social engagement developed with organisations quickly moving to online activities. There's been a number of activity packs sent to adults and children with learning disabilities to their individual homes. And for many adults with learning disabilities and family carers, they learned new skills to use the internet, to use social media platforms to stay in contact. But 18 months down the line, not all adults with learning disabilities enjoyed these activities. So like I said, I'm just going to give you a couple of examples of what has happened, particularly working with these 4 voluntary organisations. So CAN had quizzes. Positive Futures put together family support packs for specific children with learning disabilities in their area. Again, some people with learning disabilities were able to make it to the media on Cool FM. Others were able to go on to the BBC Sunday Sequence programme and speak with Agnes Lunny, from the Chief Executive. And again, CAN, I like this collage. This is from CAN. If you can't see it, I'll just read it out. We are so proud of you and can't wait to see you again. This too shall pass. Big hugs. Remember, I can, you can, we can. Stay safe, stay home, and wash your hands. So again, staff going to extraordinary levels to create further activities to try and engage adults with learning disability. Now I'm going to share, I'm going to now ask Professor Roy McConkey to come along and then just to give a summary of the recommendations and action plans based upon our COVID studies and learnings from the local pandemic. So Roy.
Thanks, Laurence, and good morning, everyone. COVID obviously brought its disadvantages to all of us, but they say that if you can see the good in what happens to you, then you're better prepared for the future. And there are some very big lessons to be learned from our experiences over the last 2 years. Here's some of the ones that seem to come very much from the information that Laurence has presented to you. The big lesson is that if there are going to be future epidemics, further outbreaks of COVID, then if the new guidance has to be issued, service users and their carers need to be consulted. This didn't happen initially and caused a great deal of confusion and angst to the service providers, to the frontline staff, to carers, and of course to service users. Thankfully, the message did get through, and after a few months, the consultations were held between the people organizing the guidance, but that lesson needs to be continued on into the future, that we do need to consult with the people who are most affected by the guidance we're giving them. The other big lesson is, of course, that now that we know things can happen very quickly, it would be important that we do prepare in advance individual contingency plans for how supports can be continued to give to service users and or to their family carers. But as well as those individual contingency plans, services also need to have their own contingency plans, and they need to be publicised and shared with one another so that carers and service users have some assurances as to what the future is going to unfold and how they could be helped as part of that. Next slide. But recovery planning, often talked about, has yet to emerge in any strong sense in respect of learning disability services. At least that's what we heard in this study and what we're hearing still. There certainly does need to be the resumption of supports to family carers and their speedy implementation. It behoves the statutory services in particular to make clear what their plans are for that resumption. You may already have heard on Good Morning Ulster how that has not been happening for many carers, even though in other parts of these jurisdictions, those plans are now in place and services have resumed to a much greater extent to what seems to be happening here in Northern Ireland. So we do want to urge that the trusts make public what their contingency plans are and how they are planning for the recovery of the services, particularly to family carers, who, as you've heard, have been under enormous stress during this period. There is an emerging issue too about workforce planning. Staff in many instances have been given more running the extra mile during all the COVID period, and some of them are quite burnt out. And the retaining of staff, experienced staff, is a worry to many service providers. So there does need to be some thought given as to how we can encourage people both to stay within the social care workforce and also encourage others to be recruited to it. And that probably falls under the remit of the reform of social care. This has been long talked about in Northern Ireland, and yet we've not seen any tangible outcomes from it. And in particular, there is a need for the reform of social care to focus particularly on learning disability services, which to date has often been overshadowed by social care for elderly persons. And as Chris said at the outset, 6% of the health and social care budget in Northern Ireland goes on learning disability services. So if we're going to transform and reform those services, then learning disability does deserve particular mention. Next slide. But as you've heard from the Prime Minister downwards, the whole thrust of many of the recommendations is about building back better. because COVID has probably shown some of the severe weaknesses that there is in our current service provision for people with learning disabilities, not only in Northern Ireland, but in these islands. But why would you want to follow bad examples? So we do know that the Health Board has been considering new models of provision in learning disability. Their report seemed to be made public just before COVID struck, and there's been very little opportunity to consult on it or to validate its proposals with carers and service users. And in particular, the report gives little attention to the costs that are going to be involved in rebuilding services, particularly how existing monies could be better used and what new monies might be required. It certainly is an important aspect if we are going to really provide the services that people need and aspire to having. So that's why we're urging the Minister to undertake a value for money review of how current monies are being spent and the outcomes, or indeed lack of outcomes, that emerge from those. A very strong message internationally has been that we need to move from congregated service settings to much more person-centered, individualized services. Congregated settings were places where people died. It was where people got the infection, where they were put at risk instead of being kept safe. And congregated settings are not just in residences, but also happen in, say, daytime activities as well. Internationally, the thrust has been towards providing more individualized, person-centered services that are well demonstrated to produce a better quality of life for people with learning disabilities and thereby give good value for money. Northern Ireland has been particularly slow at developing those services, and sadly, we've reaped the unexpected and unwanted outcomes from that. An approach that's also used throughout the United Kingdom has been greater use of direct payments so that people can choose the types of supports they wanted. These direct payments can be given to individuals or to family carers. And indeed, the department has long said that it wants to see an increase in the uptake of these direct payments, but that has not happened. And it did not happen during COVID, or only to a very limited extent. So families didn't even have the option of organising their own supports when those that were provided by the statutory authorities were no longer available. Fortunately, those that were involved with voluntary organisations in the non-statutory sector were able to have some of those supports maintained, as you've heard, but that was to a much limited degree. The one big miss that we have in Northern Ireland too is the lack of regional data. Some trusts may keep some records on some of the clients, but how do you plan when you don't know what you're dealing with? So one of the things we do need to consider is how we could get better regional data about the services that people with learning disabilities need and require. There are modern ways of doing that through data linkages, and NISRA would be one of the organisations who could give advice, particularly to the department, about how they should do that. And we've also been rather taken aback as people have told us about the lack of leadership that there is currently within learning disability services in Northern Ireland. Now, there are exceptional individuals working in those services, and we're very grateful for that. But unless we have systems whereby we can account for what services are being delivered and what they are costing, then we will not know how better to improve them. So one of the things we're saying is that there needs to be some form of independent review panel, maybe headed up by an independent person, who would then each year provide a report on how services have been delivered. And that report could be presented to the Assembly and to the Minister. And in that report, there would be obviously opportunities to commend what is working well. And if it's working well in one trust, why isn't it happening in other trusts? Because that's the situation at the moment. or if there's things that need improved overall, as well as within individual trusts, then that's another opportunity for it to come into the public domain and for it to be recognised and for actions to be developed. Well, those are some of the lessons we would see coming out of this particular report. But the opportunity today is to get reactions from all the participants, the many participants who have joined into this all-party meeting. And we're particularly grateful to Chris and the all-party group for this opportunity to share with you some of our findings and our thoughts about the implications of it. Thank you very much.
Thank you. That's right. So do you want me to stop sharing my screen, Chris?
Yeah, that might help in terms of allowing us to see respondents. Okay. Okay. Laurence, Roy, can I say a huge thank you to both of you and to all of the organisations that I mentioned earlier that have been involved in this vital work. I think we're indebted to all of you for presenting such an evidence-based expose of the severity of the impact of COVID on people with a learning disability and the extent to which people with a learning disability and their families feel let down. And the recommendations that you're making are a really constructive way and for us to improve the response rapidly and should be heard as a clarion call to the executive departments with responsibility for restoring services and support for people with a learning disability and their family. I'm delighted that we've had almost 70 participants in the all-party group today, and perhaps it would be important for me to acknowledge the attendance of the all-party group on learning disability Deputy Chairperson Colin Gildernew, MLA, Carolyn McKillen, MLA, Nuala Tommen in attendance as well, Rachel Woods, MLA, and Pam Cameron, MLA as well. If I've missed any of my Assembly colleagues, please alert me to that and feel free to come in for questions as well. I'm conscious we also have a number of Health Department and Health and Social Care representatives here as well, and maybe if any of you at some point during our question and answer session would like to take an opportunity to offer a Health Department or a Health and Social Care response to the findings and the recommendations that have been presented today, we'd be really grateful for that. If people want to ask a question, if you can, given the amount of participants, it is difficult for my screen, and it's quite a large screen, but it is difficult for my screen to see a physical hand raise. So if you can use the hand raise facility on your Zoom, memory serves me correct, it is in the reactions section there. I'll be glad to bring in as many people as possible. And obviously we have the chat facility as well there if I'm failing to see your indication. But yeah, let's move to those questions and answers. I'm keen to bring in as many people as possible in response to those stark findings and also the recommendations for the way ahead. Who would like to ask a question? And feel free to introduce yourself. I see Rachel Hogan from the Children's Law Centre there with the hand raised. Rachel.
Thanks, Chris. Hello, everybody, and thanks very much for that presentation. That was actually heartbreaking to listen to, even for all of us here who are used to what's been going on during the pandemic, but extremely informative in terms of capturing the evidence and the stories of the individuals involved. I think it's a fantastic piece of work, and the constructive attitude then of looking for solutions that we need to bring forward here. One of the points I just wanted to raise was obviously in my work it's children that I'm looking at, and here we're talking about adults, but I think there's a lot of parallels in what the experiences have been. And one of the points we've been focusing on really is the Section 75 duties of the government departments. Roy had mentioned the lack of regional data and such. So part of the Section 75 duties is to have that data so that services can be properly planned and particularly disaggregated disability-related statistics and data. And that duty to consult is also extremely important within that framework as well. So I just wanted to highlight that to any decision makers that are with us today. We actually have outstanding legal actions against one of the departments in relation to failure to implement Section 75 properly during the COVID restrictions. And the other thing I think we need to think about is a human rights analysis of what has been happening. I was very struck by one of the audios and videos that we watched there, and the young man said, "I can't see my daddy." And that just hit me so hard. Such a simple statement, but it brings us down to where we're at here. I can't see my daddy. And that was just one of the restrictions that that person faced. So it's that proportionality of decision making and balancing of human rights. And I think the balance has gone horribly wrong somewhere in relation to people with learning disabilities, which I think would be the majority of inquiries we've received, is people with severe learning difficulties who have suffered the most inhuman and degrading treatment, as have their families, and really restrictive measures on their family life and life in general. I just want to very quickly give you a couple of examples of matters I'm dealing with in relation to children too at the minute. So children who can't go to school at all because they can't get adequate school transport, because they might need an aerosol generating procedure in an emergency. No risk balancing there, when have they had an emergency? Is there an alternative method of transport? Can someone else drive the car? A lack of creative thinking, in my view. The other thing that keeps coming up is COVID test methods. Some of our people with learning disabilities can't tolerate a swab test, and they don't seem to be able to access other methods of testing. And I think that is a huge issue, because if they can't get a test, they can't then, for example, go to school or go out and about. And obviously the respite that has been discussed today, we have a lot of ongoing legal proceedings in relation to respite, and that problem just is getting worse and worse. So I'm very interested to hear going forward what the recovery plan is going to be, and how it's going to urgently tackle the lack of services currently available to people with learning disabilities, and then how going forward it is going to build back better. So thanks again very much for your report. I'm certainly going to make as much use of it as I can in my work. So thank you.
Thanks for that, Rachel. And the recovery plan is absolutely essential. The All Party Group presented a motion to the Health Minister that was agreed by the Assembly, I think as long ago as May. And obviously the All Party Group delegation did meet with the Health Minister recently. So as I said, hopefully we can get some reaction and response from our officials who've kindly attended today on some of those key issues. In the meantime, can I bring in my colleague Rachel Woods, MLA, please? Thanks.
Thank you. Thanks for trying to find the hand. We've been on this for nearly 2 years and I still can't find the hand. Thank you very much, and apologies on my lateness. I had another appointment before this, but there's so much there that I did pick up, and I'm hoping to be able to see the report in more detail if it can be shared. But I also just wanted to pick up, like Rachel, on the data collection. This is something that we're dealing with across the board, about the lack of data collection, or some places are collecting data. And I wonder maybe if the officials from health could maybe give a little bit more information about, is there barriers there? What's the issues? And I think on the Section 75, I do believe that there are some maybe differences in how Section 75 is interpreted in different departments. So it's certainly something I would like to pick up on. And like Rachel has mentioned, I'm even in the office dealing with a lot of families and a lot of people who are missing out on education and missing out on support and services. And certainly I know where there's a number of legal actions being taken, but the recovery plan is so important. And just wanted to pick up on that data collection, because it is something that we're trying to work on, and maybe if any officials could give us a wee bit of an example of what the issues are, if there is any, or is it just not being implemented?
Thanks for that, Rachel. I'm hoping that I'll get some official volunteers, because I know who is here. I'll not start calling on you soon otherwise. Excellent. Nigel Chambers from the Department of Health. Thanks, Nigel.
Apologies. My responses will be quite brief, in that the department was here to observe today's discussion and to draw the key themes to inform Minister. I suppose to answer your question directly about the availability of data, We work closely with the Trust to get an understanding of the data in terms of the level of service provision and cases, infections, and hospitalizations and deaths. Because we've been very conscious that in England and Wales, data emerging last year showed a very sharp rise in deaths for people with learning disabilities. The early data coming from Northern Ireland would indicate that we have not had a comparable experience. The deaths have been quite low. However, this is being validated by NISRA, who are undertaking a full review of all mortality data by Section 75 characteristics, and that will be due early 2022.
Thanks for that, Nigel. And I appreciate you're in an observing capacity today. There's absolutely no way I'm going to let you off without having to answer your question as well. Is it possible to provide any degree of update with regards to some target dates for the full restoration of services and recovery plans? And we are grateful for the recent engagement that the Health Minister gave with the all-party group on learning disability.
I wouldn't be able to provide dates. However, I can provide an update on where we're at in terms of restoration of services. I'm not just joined today by colleagues from the department, there's colleagues from the Health and Social Care Board, and Deirdre McNamee, who left the call, was from PHA, who led on the review of adult daycare and short breaks. And there are a number of colleagues as well on the line who are from Health and Social Care Trusts, who have been responsible for trying to restore services within the constraints of infection prevention and control guidelines. The review that we commissioned the PHA to undertake was to assess the risks associated with restoring services back to a level seen pre-pandemic. The key barrier to restoring services within adult daycare is the need to adhere to social distancing requirements. That has placed a hard ceiling on what trusts have been able to do to get services past around 50 to 60% of what they used to be. In terms of short breaks and respite care, trusts have needed access to beds within care homes. And you'll be aware that for people admitted to care homes, there's a requirement that they isolate for a period of time, 14 days if they were a long stay resident, but if they were accessing respite care, they could be isolated for the entire duration of their stay. And for accessing respite beds, that has meant that families have been in a difficult position of being offered a place where their loved one will be kept in a bedroom for the entire duration of their stay, or in care homes, they would not be able to guarantee isolation, so those respite beds have not been available to trusts. So the PHA have carried out a risk assessment of those settings, an analysis of infection prevention and control guidelines, and presented a series of recommendations to the department that would enable us to increase service delivery. Those recommendations are currently sitting with our medical colleagues, and we expect input imminently. Once we have received that feedback, it will go to Minister for decision. I suppose the question around implementation, we've been working very closely with our trust colleagues, and they've been involved in the development of the PHA review. So following ministerial decision, we will then work with colleagues to agree dates and timeframes as to when services can be restored to a level that families are more normally accustomed to.
Nigel, I sincerely appreciate that update. There is a level of information there that hopefully can provide some reassurance. Can I ask if that implementation, if we can at least hope that will be initiated prior to the end of the mandate, Nigel, and then I will finish there. Appreciate your responses.
In terms of we're hoping ministerial decisions this side of Christmas. So the implementation should follow soon after that.
Okay, I do genuinely appreciate those responses, Nigel. We didn't have you scheduled for a question and answer session, so as chair, it won't turn into that. But I do appreciate the responses that you've been able to give there. Thank you for those. Okay. Also
just
have
in terms, just in terms of Roy's
sorry,
question,
Nigel, go ahead. Yep.
Roy's question. Yes, the PHA review will be made publicly available following ministerial sign-off.
Thanks for that question and for that response, Nigel. Good eyes on the chat section. Well done. Okay, can I also see a hand raised from Peter Archdale? Peter, do you want to introduce yourself and,
thanks
make
very
a
much.
comment or ask a question? Thanks.
Yeah, thank you very much. I'm chair of Campbell Community Clannabogan. I've been there for 4 years. I just wanted to make a point that I don't think has come across strongly, but this sector is so bloody complicated with so many different players in it, and many of the problems that have been highlighted, and thank you very much, Laurence and Roy, for your presentations, which I found very useful and helpful. I don't think even the department fully understands how complicated it is. I won't embarrass anybody by saying by citing evidence, but I think others from the sector may support that view. Where certainly COVID has highlighted, there are some of the delivery mechanisms, and I'm going to blow the Campbell trumpet here, are very effective in this sort of scenario. I'd like to have some way of pulling out where those positives are, as well as what essentially were a lot of negatives. And the positives are that community really works, I believe. That's basically the point I wanted to make. Thank you.
Thanks for that, Peter. Appreciate your contribution. Can I bring in Carol McKillen, MLA, before Agnes Lumley? Thanks. Carol.
Thank you, Chris. And again, apologies. I had an urgent constituency issue I really had to deal with. But like many others, I've heard a lot of what's been said, and you know the issue for me is, and Rachel raised this in terms of the equality impact assessments. So we're on the record on the Health Committee asking for full equality impact assessments of the budget. And even in the departments, and I dare say it's not just the health department, but certainly, Chris, you'll know that the education department have done this as well. The screening exercises that they're doing already showing that, certainly for health in the last budget, that the minor and major implications on equality, disability has been cited as having a major impact. And even with the department's own data, there's still no reflection in certainly the COVID recovery plan of how that's going to be dealt with. So the issue that we have raised is we welcome the fact that there's going to be multi-annual budgets, but there does need to be a full equality impact assessment on those. I've also heard discussions around value for money reviews, and I think we just need to be careful because it all depends how that review is measured and monitored. If it does not, any review does not take into consideration, and I'm going to be, pardon my crassness here, but if it doesn't take into consideration the money saved to any health trust by the work of families, carers and community and voluntary sector, then we're going to get the same results. So it's just to let you know certainly the technical scrutinizing of the equality impact assessments and all the reviews and how those reviews were measured and monitored and what the outcomes of those reviews are measured against the promotion of better equality outcomes is something that I'm personally over quite a bit, because I don't need to tell you or anybody else in this call that you can't keep having the same reviews and assessments coming up with the same inequalities and not having an uplift in budget or attention or priority. So it's just to share that with you. And Chris, thanks for bringing me in.
Appreciate that contribution, Carol, and the representation that you give the Health Committee. I think that is one of the strengths of the all-party groups, is that as MLAs we can come together and we can represent the cross-departmental committee interventions that we can make. And I think a quality impact assessment of budgets is super important. So thanks for that, Carol. I think we have a hand raised now from Agnes Lunny. Agnes.
Thanks, Chris.
We're creating space to talk about a range of issues.
Can you hear me, Chris? Yeah?
I can, yes.
Yes. Sorry. Yeah, it's Agnes Lunny here.
UTV as well. Apologies.
I've got UTV on as well. Okay.
No problem.
So yeah, I suppose I just wanted to raise two issues. I'm Agnes, Chief Executive of Positive Futures. We support children and adults with a learning disability, autistic spectrum condition, and acquired brain injury. And I have to say, I absolutely agree with all of the questions that have been raised. And I'm particularly moved by the testimony from Rachel at the Law Centre, and something we experience day in and day out. And I think, how many times do we have to say, we said this before COVID, that carers are absolutely stressed. And I would go as far as to say now that so many carers are just at their wits' end. But we need to understand, I think, the importance of, we need to, sorry, there's an interference coming in here. We need to.
Yeah, Agnes, let me see if I can address that for you, because I want you to be heard nice and clearly. I think we need UTV to mute if they can hear me. Yep. I think that's us sorted. Great. Apologies for that, Agnes. Thank you.
Yeah, sorry. Yeah, just I mean, hopefully people did hear me, but I think we've known about the huge responsibility for caring that rests with families, many of whom are ill and elderly. So I think that point again has been made very, very strongly today. But the other 2 points that I want to make, one is about the availability of services. Organisations, very much so in the voluntary sector, including our own, continue to deliver services during COVID. We understood our responsibility was to reconfigure those services, deliver them differently, and that is what we did. So our services continued not to deliver 100%, but far in excess of 100%. So again, the expectation was on us to continue to deliver services, and we stood up to that expectation and probably exceeded our own expectations in terms of how we deliver services. So there is a way of delivering services, and I understand Nigel's point about social distancing and day services. We've also got to work within guidance. But, day services, we need some creativity here. Day services don't have to be 9 to 5, Monday to Thursday, and 9 to 2 on a Friday. People's lives extend beyond 5 o'clock in the week and also extend to the weekends. So why can't we reconfigure services and have day services running over the 24 hours of the day? Equally, there is availability of short breaks in Northern Ireland. We're sitting with a service in Belfast that the Trust have failed to purchase the beds that are available there, which means that there is any given night of the year, there is capacity for another 2 families to get breaks, but the Trust won't fund it. So I think the value for money question is a really important one. We need to know what is available out there, and we need to know what outcomes are being achieved. And finally, those who have heard me say this, we are not in a precarious position in relation to workforce. We're in a really dangerous, critical position right now with workforce. Our staff are simply exhausted. We cannot recruit to the workforce because it's not attractive. We can't retain because other organisations and businesses are taking our staff. Not least, our staff are going to the statutory sector, who earlier this week we were told has had another 3% uplift on their salaries. We need an equal playing field, at least an equal playing field. And we need this workforce issue to be addressed right now, today, in order that we continue to deliver safe services, not into the winter, but right here today. Thanks, Chris.
Thanks for that, Agnes. Really important contribution. And I see that Janet Schofield from CAN has also commented on the need for transparency with regards to where the spend for short breaks and respite would have gone, and whether that will be reallocated to creative solutions for families. Janet, do you want to speak to that briefly, or are you content that I have covered that?
Yeah, I mean, I suppose Agnes and I were obviously thinking of the same thing at the same time, but I mean, this is critical. This is the backbone of learning disability services, and families are at breaking point. Similarly, the likes of the services that we would have been providing in the past have all been put on hold, but that funding has gone somewhere, and my fear is that it will disappear. And we need to make sure that there are creative solutions. I think the voluntary sector, as Agnes said as well, is well placed to provide a very quick response to these situations. We are used to working on a shoestring, and we're used to being creative about solutions. So, you know, this is one of the opportunities, I suppose, coming out of COVID, is to put more trust and more faith into our sector.
Thanks, Janet. Can I then bring in Paul Betts from Glencraig? Paul?
Hi, Chris. Hello, everybody. Yes, Chris, I mean, just back to, in terms of COVID and learning disability, a lot of good things were done, and the department, I think, did respond under a pandemic in many ways, for which we're very grateful. I think in terms of lessons learned, the guidance was slow to come out initially, and everybody was having to react in their own way. But I think, Chris, when the guidance did come out, because of the crisis within the care home sector, learning disability was basically forced into that box. And so the guidance was okay, probably for care homes, but wasn't fit for purpose for those with autism and learning disability. And it took a number of meetings. I mean, again, the beauty about our little country is you can get access to Dr. McBride and those with responsibility, and even the minister. And we were able to have meetings last summer about these issues. But it still did take a long time to get learning disability recognised. And because, as I think as Peter Archdale said, there's various flavours of how learning disability is supported. There was an inconsistency as to how we were able to apply the guidance for families and for residents or for day attendees. So for instance, we had parents coming to us saying, could we come to your property and walk our child with learning disability because the statutory services, day services have closed down. But because we were under care home guidance, we weren't allowed to have visitors. We weren't allowed to have other parents come on site. And that would have been an opportunity where we could have helped each other, but it wasn't, the guidance wasn't fit for purpose, is what I'm saying.
Thanks, Paul. Appreciate those comments. I see, yeah, Brenda, thought you were indicating there. Brenda Arroy from Finney. Brenda?
Yes, no, thank you, Chris, and thank you very much for everybody who's turned up today, the MLAs, and we really appreciate you making the time for us, and also the health service representatives, and of course our families who have made the time, which can be very difficult for them. I think that this piece of this survey, I would really like to see now actively being used as a kind of a catalyst to sort of turn things around. I think the families have been waiting very, very patiently, and they're people with learning disabilities, but I think we need action now. And although Nigel did mention that the report maybe get ministerial approval and published in January, that's only looking at the day centres. And I think that Rachel talked about a creativity now in sort of bringing together all the heads that we can to sort of find a way out of this. And that includes the families who probably know what is going to help them in their own particular situations, but also the service users themselves and the service providers. I think this has to be a joint effort to find our way out of this. These people cannot wait any longer. And I really want you to try to take that message away today. This is a serious situation for people, and yeah, we need some answers. So and some plans. So I would really be grateful if there was one thing that came out of today, is that we can plan a way forward immediately and not waiting. So. But I'm glad that we have this evidence. I see this as an opportunity going forward to gather the evidence, to gather the research, to try to build something better for people with learning disabilities going forward. Thank you.
Thanks, Brenda, and thank you for all the advocacy that you've done in recent times as well. It's sincerely appreciated. Can I bring in Gráinne Close from MenCap and then Patricia Gunn? Grania?
Hi, how are you? Thank you, Chris. It's just really to repeat what Brenda was saying, but also just really welcome the comments from Nigel from the Department of Health this morning. I think it's really, really important, and we know because we've heard it from families, we've heard it from families today, we've seen it in the report, just the impact of the lack of support services for respite for families. So we really welcome the full restoration and the timeline. And I know that there has been lots of frustrations around this, not just coming from the department, but also from the trust that we work with in terms of the guidance that's coming out, that it's not clear. So I think just in agreeing with what everybody else is saying, that we really have to come up with creative solutions around this and, you know, basically get the respite and day services opened up again, because as we know, our families are at the wit's end. So I just think it's great that we are looking at an implementation, and the time frame is really important for making sure that we have the full restoration of our services in a safe way, of course, but just really welcome this report. I think it's really timely today on the International Day of Persons with Disability. So again, thank you to Laurence and Roy for the work on the report. We have really appreciated it, and I think today it's about taking action and really again promote the 7 asks that we have, Chris, that you talked about at the beginning of the meeting. And maybe if we mention those again, I let you say those ones, but I think that's really important. So thank you.
Thanks so much, Grania, and thank you to MenCap for all the work that you do in support of the All Party group. Can I bring in Patricia? Patricia Gowan.
Well, thanks very much, and thanks for this morning. My name's Patricia Gowan, and my brother, I provide support to my brother who is a 51-year-old man with Down syndrome. Sorry, my voice is a bit gone this morning, but I did ask my brother, his name's Barry. I sort of gave him a little summary of the report and asked him what he would say if he was here this morning. And because he's not here this morning, because he's at the gym, because that's what he needs to do. He's getting fit so he can eat plenty at Christmas, he told me. So basically his view was that with Omicron, because he's obviously watches the BBC News, is everything going to happen again? And if everything happens again, is it all going to be the same in terms of his experience, his need for protection, his need for support? Will it change? He said, so are you having a meeting for the sake of having a meeting? And I said, no. It is actually to affect change, to make things better. And he then said, well, I have to go now and I'd like them to walk a mile in my shoes. And I think those are the things that were very clear this morning from him as an adult, having experienced and gone through COVID. I think probably what comes out of that, excuse me, is that what's the next step, which, you know, Brenda has touched on there. What's the platform in terms of how Barry's voice is heard? And he's a more than capable individual. He is, as my mother, God rest, would say, her most remarkable son. That doesn't go down well with the brothers, but that's how it is. And in his voice, where does it belong and where is it heard? Both now in what, and you do have to look at the positives. COVID has exposed the gaps in the services for adults with learning disabilities. But that's a great thing. The gap analysis is done. The information is there. This report throws it up. So how are things going to be framed going forward? What is the response going to be to that? There is a huge amount of work that has already been done in what you've seen in the report today. But what I'm interested in, and what people such as Barry are interested in, is right here, right now, what's going to change? How is the experience going to be different? Is there going to be genuinely any degree of co-design or co-production in terms of the services for adults with learning disabilities going forward? And that transparency, as touched on earlier, around the financial analysis. Whatever the amount of money in the purse, you know, it's the creativity with how it is spent that will make all the difference. And it's not necessary that there's a huge need for lots more money. And as was touched on earlier, the congregated settings are not something that is effective and does not meet with that individualized and person-centered choice. And I'm just, the biggest thing is, where do we go from here? Because unfortunately, the world works in such a way that only Barry will walk a mile in Barry's shoes. None of us will. That's not our experience. The closest we are ever going to come to some of those challenges is what we all saw on the BBC News of elderly services and care services in that way, because that's when we as adults begin to have less choice and less opportunity to determine what happens to us. And so in terms of the transforming social care and what platform is used going forward, that's the thing that I'd be interested to know, is how we take this forward, what's going to happen, and whether there is really going to be a difference, so that I can report back to Barry when he gets back from the gym, because he's much fitter than me.
Thanks so much for that, Trish. I'm going to have to schedule the gym now to ensure that I can eat as much as I can at Christmas then. I'd left out the gym part of that plan, unfortunately, so Barry's ahead. Sincerely though, Trish, thank you. I think your comments summarise our work today very well. And I'll give a final warning for any further questions here, just as I build on Trish's closing summary there as well. But as you said, Trish, the pandemic has exposed inequality. It has affected people differently. The excellent research presented today from Laurence and Roy shows how it has affected people and families living with a learning disability more severely than others. Shielding, isolation, loss of daycare, loss of respite, impact on education, contact with family, the lack of access to GP, most acutely felt by people for whom that is a first port of contact for support services, and even to the point of suicidal thoughts as well, as we heard today. This has to be a clarion call to everybody with responsibility to work to ensure that does not happen again, Trish, as you said. And we do thank the Department of Health and the Health and Social Care representatives who are in attendance today. I'm endeavouring to process potential next steps and next actions. And Nigel, perhaps you could take back to the department and to the minister that maybe a ministerial statement could be considered in due course. I think it would be really helpful if the All Party Group and everyone in our community, most importantly people with a learning disability and their families, got a clear statement of intent from the minister in due course with regards to the recovery plan and to the restoration of services. If you could, I hope people think that's a constructive suggestion for us to send to the Department of Health, and I think that ministerial statement, assembly based or otherwise, would be really helpful clarity for people on these issues. I perhaps again, just as a final warning, just restate the 7 clear asks that are coming from the All Party Group on Learning Disability and everybody present here today, further to this research. And if anybody wants any final questions, final closing remarks, happy to try and facilitate that just once I've made these clear again. But number 1, that the Health and Social Care Trusts urgently communicate their recovery plan for learning disability services, most notably day centre and short break provision. Number 2, reform of social care proposals must make specific mention of learning disability provision. 3, that the new model for learning disability service needs must be validated with service users, family carers, and service providers. 4, as has been mentioned a number of times today, there must be value for money in learning disability service provision. 5, the implementation of personal budgets and use of self-directed support to empower people with learning disabilities to have more choice and control. 6, we ask that the deaths of people with a learning disability and those who develop COVID-19 and future infections in the family home, and in residential care are recorded and acknowledged. And 7, that the Department of Health appoint a learning disability reviewer with clear responsibility for holding the system to account for delivering agreed outcomes and policy implementation to deliver equality for people with learning disabilities. Members, I trust you've found today productive. As people have said, the findings and the experience of people with the findings of the study and the experience of people with a learning disability during the pandemic has been severe, and it is incumbent on all of us with responsibility for responding to do all that we can as urgently as we can, to put changes in place to make sure that that doesn't happen again. Folks, thanks so much for your attendance today, your contribution. Thanks to everybody that has been involved with producing this study, to Assembly colleagues, Department of Health and Social Care representatives, all our voluntary and community sector representatives, all our families, all our people with a learning disability. Thank you so much for making the all-party group the important group that it is. And as I say, hopefully we will get some clear responses from the Minister in due course about the actions that are going to be taken in response to this important work. Thank you.
Okay, thanks very much.